evening, curious minds. Welcome to the community and thanks for your interest in science. I'm recording this meetup session and tomorrow I will upload it on my YouTube channel, the link of which will be shared in the meetup chat. Today we are discussing the science of ADHD. In this talk, I will provide a comprehensive overview of the science of ADHD. We will discuss various facets of ADHD, including the causes, neurobiology, treatment options, and strategies to conquer it. The talk aims to reduce stigma, encourage open conversations, and empower individuals with the knowledge and tools necessary to manage and overcome ADHD. So let's get started. And remember, curiosity is the key to unlocking the wonders of science, so don't hesitate to ask questions or share your thoughts after the talk. Before that, please be advised that the information provided here is for educational purposes only and should not be used as a substitute for professional medical advice, diagnosis, or treatment. If you or someone you know is experiencing symptoms of ADHD, it is crucial to consult with a qualified health professional for personalized guidance and support. ADHD treatment should always be tailored to the individual's unique needs and circumstances. Before moving into today's talk, let me introduce myself. I'm a cancer immunologist, educator, and science communicator. I write 2 newsletters, as the details are given here. Please do check them out. They are free to subscribe. I also have a science book meetup where we are discussing this month Breath, The New Science of Lost Art by James Nestor. It's a very interesting read, and if you are interested, do join us on May 25th. I have another important announcement to make. We have recently launched our website, curiousandcreativelab.ca. I encourage you to check it out and explore the various services we offer. If you are interested in any of our services, don't hesitate to book your first 30-minute consultation session through the website. We look forward to hearing from you. Now let's move on to today's topic of science of ADHD and ways to manage it. ADHD or ADD disorder is real. It was initially called as ADD, but later in 1980s it was realized that hyperactive component is a big part of it, and so the ADD term was changed into ADHD, which is attention deficit hyperactivity disorder. It is a chronic neurological disorder, and due to its chronic nature, it is often referred to as the diabetes of psychiatric diseases. Research has shown that people with ADHD have differences in brain structure and function, as well as clear and consistent patterns of symptoms that can cause significant problems in their lives. The key aspect is what makes ADHD a disorder is it's not just about having certain traits or behaviors, but about those traits or behaviors causing significant problems. ADHD is not just a disorder of attention, but a disorder of self-regulation. This means ADHD predisposes individual to adverse health outcomes and risky lifestyle behaviors such as smoking, alcohol and drug use, and poor diet and exercise. Statistics show that up to 55% of people with ADHD smoke, and 32% of people being treated for morbid obesity have ADHD. Clinical presentation of ADHD is heterogeneous with 3 subtypes identified according to the most prevalent symptoms: primarily inattentive, primarily hyperactive or impulsive, and combination of all the 3. Let me tell you, ADHD has nothing to do with intelligence. So that should be very clear. There are growing cases of ADHD. It is one of the most common childhood neurobehavioral disorder, and ADHD is not limited to children. Many adults continue to experience symptoms. If we look at ADHD cases in Canada, it is affecting approximately 5% of the children and 4% of adults in Canada, which is equivalent to 1.5 million Canadians. Furthermore, children with ADHD also present with higher rates of additional neurodevelopmental disorder such as autism spectrum disorder, dyspraxia, dyslexia, dyscalculia, which can complicate learning further. There's a question as to whether ADHD is increasing in adults or whether our lifestyle are creating pulls on our attention. Example, phone use, email, social media, etc. So this should be also clear, and we will talk a little bit more about when we will talk about the telltale signs of ADHD. So we all at some point of our time deal with difficulty of focus and attention, but this should not be considered as a disorder. The disorder is completely a different thing, and the attention deficiency or because of lack of sleep or a stressful situation going on or chronic stress or any kind of painful situation, during these circumstances we lose our attention. So this is different from the attention disorder. Attention deficit hyperactivity disorder is a neurodevelopmental disorder, and it comes with serious consequences of it starts from the serious anatomical brain changes and neurochemistry changes of the person. So this should be very clear. So there are gender differences in ADHD symptoms. Boys and girls often exhibit these symptoms in different ways. Boys are more likely to display overt physical hyperactivity and impulsivity, behaviors that can be disruptive and more easily noticed. On the other hand, girls with ADHD often exhibit more inattentive symptoms such as being forgetful, disorganized, or easily distracted. These symptoms can be less disruptive and thus more likely to be overlooked. And when we see the stats, ADHD is diagnosed more often in boys than in girls. If the ratio is around 2:1 or 3:1. So this is important. When you are a parent, understand the symptoms will appear differently between boys and girls. So now let's talk about the telltale signs of ADHD or ADD that should prompt someone to seek attention, to seek treatment. So, inattention or the inability to direct and maintain. So, inattention or inability to direct and maintain selective attention to motivationally relevant tasks is a key feature of the disorder. Impulsivity refers to acting rationally without apparently thinking of the consequences, such as blurting out answers in the class. And the third telltale sign is hyperactivity, which refers to specifically uh, to excessive motor activity. It signifies that a child or an adult also has difficulty regulating their body in the sense of sitting still, not fidgeting, not interrupting, not being able to wait their turn in line, and so on. So it just adds a physical dimension to the hyperactivity that takes place in the brain itself, where too many thoughts follow one another randomly and with no rational progression. So if we recap this: inattention, impulsivity, and hyperactivity. These three are the cardinal signs of ADHD. And beyond these cardinal signs, many difficult to quantify associated signs of ADHD exist. For example, disorganization is frequently cited as one of the main indicators of inattention. However, disorganization can be produced in many different ways. It can result from poor general motivation or can reflect an impaired ability to value long range goals over short term rewards. Even when ADHD individuals are motivated, Disorganization can arise from an inability to plan ahead and order the necessary steps to accomplish the goal. So this is a major sign of ADHD. The people are disorganized, they cannot plan things ahead. Many steps, tasks are confusing to them, and they can't put weightage to the long term rewards and short term rewards. So this apparent disorganization could also result from poor working memory that impair the ability to maintain goals and to plan in mind. Or it could be produced by an inability to adjust behavior to meet changing contingencies. So, besides this, ADHD individuals are also socially adept or may display decreased frustration tolerance, increased social isolation, and affective instability. In addition to the diagnostic subtype heterogeneity, ADHD individuals can show a great deal of intra individual variation. Variation among themselves is intra individual. So, ADHD individuals may excel at some task and may even appear hyper focused if greatly interested in a task, but in other settings, performance may fluctuate rapidly. So, despite the stereotype, people with ADHD can be hyper focused, but only focus attention on things of interest. So, now let's switch gears and talk about the causes of ADHD or ADD. So, there are two different viewpoints for the causes. One states that it has a genetic basis, ADHD is a heritable disease. And the other one says that rather than an inheritable disease, attention deficit disorder is a reversible impairment and developmental delay with origins in infancy. It is rooted in multi generational family stress and is distributed social conditions and in disturbed social conditions in a stressed society. We will explore both of these viewpoints in elaborate and we will understand what mean by all this. So ADHD is highly heritable, the first viewpoint. It is based on the studies of families, twins, and adopted individuals, which suggest that genetics contribute to about 70 to 80% of the risk for developing ADHD. So, ADHD, like many other psychiatric disorders, is believed to be influenced by multiple genes, each contributing a small effect. So, still now, we don't know a specific genes which is causing ADHD, but there are several genes which are involved in ADHD symptoms. So because ADHD is a function of neurotransmitters. So the ADHD symptoms are because of the lack of neurotransmitters functioning properly, and so it makes logical sense that any changes in the genes of these neurotransmitters will be responsible for ADHD symptoms. So it is this based on this hypothesis, it is noted in the studies that the genes which are associated with dopamine receptors, serotonin receptors, or the catecholamines, adenoreceptors, all the ones which are either responsible for transporting these neurotransmitters or they are responsible for their proper functioning. So these genes are actually found to be responsible for ADHD hereditary reasons. So, but it is also important to note that having a particular variant of these genes does not guarantee that a person will develop ADHD. Instead, these genetic factors are thought to influence the risk of developing the disorder in combination with environmental factors and their interactions with each other. So, ADHD is considered to be a complex disorder meaning that it's likely influenced by many genes as well as non genetic factors. And that's the view which is held by the second view for the cause of ADHD. So, this states that it's a biological developmental disorder. So, for the most part, genes don't determine or cause anything that happens. They just lay out a set of potentials that might happen given the right or wrong environmental inputs. So, in the book Scattered Minds, Gabor Mate is focusing on this viewpoint, and he has elaborated this viewpoint by giving many different examples from his own practice. And he is focusing on the point that ADD kids are actually temperamentally highly sensitive creatures. So that's what predisposed them to develop ADD in the first place. And how this happened is because these kids sense stress very easily. They can sense if a little bit thing is slightly off in the surrounding environment, it can trip these kids emotional alarms. And we all know when we feel this emotional pain or emotional alarm, it can switch on our stress response. So either the stress response comes in three different flavors. We can either fight, we can fight, flight, and freeze. So most of the time, when kids cannot fight and cannot fly from the situation, they tend to do the freeze response. So they do this by tuning out, and distractibility first develop as emotional defense mechanisms against this kind of stress. So Kabor Mate is focusing on this viewpoint because when we see ADHD symptoms, we just focus on their hyperactivity, their hyperactivity, or their lack of attention, lack of focus, and disorganization, and all these traits come into the picture. But we forget or we don't focus on the point that this is a developmental disorder. The brain, when was developing, the brain develops when we are child. During our childhood, the brain is developing very fast. So if this environment is very stressful, the child is perceiving the environment in a very stressful and a very stressful emotional state. The child will start using the defense mechanism by freezing response, by tuning out and getting distractible. So these are the methods the child has learned to deal with that emotional stress. So this is emotional defense mechanism of the child, and that is being depicted or reflected as ADHD symptoms. So here this should be very clear to the person who's treating a person with ADHD that only drugs are good, but only drugs will not be able to cure this person. You have to have a certain set of behavioral treatment or cognitive therapy treatment, or you have to change the environment of this person and learn to switch off that stress response. So, this is important in a holistic way. We will talk about this in a while, like what should be the holistic approach of treating ADHD. So, in summary, ADHD is rooted in a combination of genetic, environmental, and social factors. So, ADHD affects various parts of the brain, such as working memory, planning, response inhibition, vigilance, emotional regulation, and motivation. So, if we look at this figure, it will tell you the three different regions, three different areas where ADHD mechanisms happen. So it changes in the brain structure and function, then genetic variations and environment come into play. So it's an interplay of nature and nurture. So Besides the temperamental and social factors discussed in the previous slide, other factors that can contribute to ADHD are difficulties during pregnancy, prenatal exposure to alcohol and tobacco, premature delivery, significantly low birth weight, excessively high body lead levels, and postnatal injury to the prefrontal regions of the brain. So, these factors have all been found to contribute to the risk of ADHD to varying degrees. So, I want to conclude all these causes by this quote by Gabor Mate, where he states that ADD is not at heart a disorder of attention, but one of the development. Its origins lie in the interaction between genetic factors and the environment in which the child is raised. And, and the person who is treating or the parents of the child who is displaying ADHD symptoms should understand this, that both genetic factors, environment is playing a significant role. So now let's switch gears again and understand the neurobiology and chemistry of ADHD. So, in order to really understand ADHD, it's important to be aware that the condition has physical aspects as well. What I mean by that is, till now we understood that ADHD looks how it looks like outside, the traits of ADHD, the telltale signs of ADHD, in terms of a person's behavior. But now we will focus on what it looks like inside our brain and body. So, let's start with the anatomical and functional changes in the brain of ADHD individuals. So they individuals with ADHD exhibit structural and functional differences in the prefrontal cortex. This is the prefrontal cortex, cerebellum, and the basal ganglia. So why these three parts? You must know that the prefrontal cortex is the cognitive side of our brain. So this is the most developed part of the brain in Homo sapiens or humans, and this is the site of cognition. It is the site of executive functions. It is the site of emotional control. And this region is cross-talking with these two, basal ganglia and cerebellum, to control the motor functions, to control the emotional controls. So here, basal ganglia, right here, we have the amygdala, which is the stress response center. So all these three regions talk to each other, and how they are talking, they have neurons. Neurons is the basic functional unit of brain. Okay, so all these regions, they have neurons in them, millions and millions of neurons. And these millions of neurons, they talk to each other by secreting these neurotransmitters. So, neurotransmitters will carry the message from one neuron to another neuron, and like this, the message is relayed. It can do via electric impulses too. So we have many different kind of neurotransmitters in our brain. So the word itself tell you neurotransmitter. Neuro stands for neuron and transmitter stand for something which is transmitting. So this is the chemicals which are transmitting the message and taking it. And in our brain, everything works in symphony. In there's a beautiful orchestra going on every time whenever we are performing tasks. Multiple different sides come into play, and then they help us to make task or focus on things or decide that this is not wrong. So prefrontal cortex is a very important role in telling you that cognitive executive control, so top down effect. Like if you want to do something, the prefrontal cortex will tell you yes or no, this thing is good to do, this is not good to do. And cerebellum and basal ganglia are responsible for your motor control functions. So these three regions in ADHD have been shown to be um, of low volume. So anatomically, they are smaller, and also their connection is little bit weaker. What I mean by that is the neurotransmitter is not functioning well, and specifically the neurotransmitter dopamine, which is widely studied in case of ADHD. So dopamine is a neurotransmitter which is responsible for motivation, which helps you to do tasks. We will talk about this in detail. But here, let's understand these three regions which are involved in doing all this important task for us. They are not, they are smaller. Smaller means less neurons. Less neurons means l- less efficient transmission of messages. And also, lack of dopamine makes it difficult further. So, we have talked about all the three regions, the functions of the three regions, but to understand a little bit more here, let's understand this. Prefrontal cortex is the one which is setting you, it's essential for your goal directed behavior. So, this will tell you the short term goal, the importance of a short term and a long term. It will help you to plan things, it will help you um, to follow the multi step procedure. So, this is very important. It will help you to problem solve and it will help you to adaptive functioning. So, if your environment is changing, you will be able to adapt to that environment. Like if you are crossing a road, if something suddenly comes in front of you, your prefrontal cortex will take the control and help you to either stop or not to pursue that cross further. So, in different ways, the prefrontal cortex is helping us to make many different, uh, is helping to make complex decisions and to help you to focus. And then basal ganglia is your reward processing center. It is involved in habit formation and it is also critical in motor control. Similarly, your cerebellum is helping in motor coordination and it is also important for your working memory. So, working memory is something like when you hear a phone number or certain digits, a count number, so you can retain that particular set of digits in your memory for few seconds. So, that's the role of your working memory. So, you can train your working memory also, but a normal person can store like 6 or 8 digit number for few seconds. So working memory is important for us to perform tasks rapidly. And in case of ADHD, the working memory is not is dysfunctioned. So that's why they have a difficulty in performing tasks, multiple tasks. So these are the key regions. Um, and this is not an exhaustive list. This is not an exhaustive list. There are many other regions which are also involved, which are also malfunctioning. But these are the key three regions. And now let's talk about this attention network, which is malfunctioning in the ADHD brain. So this is cingulate frontal parietal cortical attention network. Don't get worried by these names. So you can just understand the CFP attention network is not working well. As I mentioned before, all the regions in the brain work in a harmony, they talk to each other. And so we have this attention network in our brain. And in case of, and these are the highlighted regions are involved in the attention focus, and this is not working well in case of ADHD brain. So this network is crucial for various cognitive functions such as attentional control, as you can understand, conflict resolution, error detection, and decision making. So v- this is this is going haywired in the ADHD brain, and hence the telltale signs or the cardinal signs of ADHD are all related to the lack of attention, focus, and hyperactivity. So when I was mentioning about the neurochemistry or the neurotransmitters, I mentioned about this particular neurotransmitter, dopamine. So, dopamine is a neurotransmitter and it's a very important neurotransmitter. It is responsible for motivation. So, if you are understanding motivation to do a certain new task, no, dopamine is required just to do any task, like to get out of bed and make your coffee, do your work. even brush your teeth. We all need a certain level of dopamine to perform our daily task. So I will tell you a cool experiment in which the scientists, they manipulated the dopamine in mouse. So they just decreased all the dopamine. So this mouse has zero dopamine in the brain. So the mouse is sitting at one place and it's not moving. And in front of the mouse, you have all the treats which the mouse love. But the mouse is not motivated to move just a little bit to have that treats. And if left with in under this condition, the mouse will not eat, the mouse will not drink, and slowly the mouse will die. So the experiment was not continued further, but this was the state where you can understand the lack of dopamine can do so much to your attention, to your motivation. You need motivation for everything. So in case of ADHD, it's not like that they don't have any dopamine. They have, but they have a little bit lower than the normal, uh, than the individuals with no ADHD symptoms. So all the drugs which are given for treating dopamine is actually functioning on this dopamine receptor pathway. So let me tell you a little bit how it works. So these are the two neurons. This is the dopamine, which the dopamine will be released from this first neuron to the second neuron. And there, here we have the receptors. You can understand it like as a lock and key. So this is your lock and this is your key. So this has been released, dopamine, it will sit in the receptor and then it will relay the message. The extra dopamine will be retaken by this first neuron. So, what happens? Two things can happen. You have a faulty receptor which is not able to take the signal, or you have this reuptake happening very fast. So, this message is not read by the second neuron, it has already been taken reuptake by the first one. So, in these two ways, very simplistic view, but in these two ways, dopamine deficiency or dopamine signal will not be able to relay to the second one. So that what the drugs will do, they will stop this reuptake. So stopping the reuptake will allow the dopamine to stay in this region for a longer time and will have the chance of for the second neuron to listen to that. So this is how the drugs work. And you will be, I just wanted to mention here that dopamine is very important for motivation, but dopamine in excess, if we exploit this dopamine in system, if we, it can cause addiction. So this is also important to understand that dopamine is also motivating us. But if we exploit this system and how we can exploit this, if we take certain if we do certain tasks or if we do if we take certain things like substance abuse, if we do so cocaine or amphetamine or alcohol, not alcohol, tobacco, these or they can increase the dopamine levels in the brain like many magnitude higher than the normal. So once our brain gets used to this higher levels of dopamine, it craves for that, and you have this pain pleasure balance. If you want to understand all about dopamine and motivation, you can check the YouTube channel. I will share later here the details of the YouTube channel. And I have this presentation where I've gone into detail how dopamine is helping us to motivate and can lead to addiction. So, and we also have this book, Dopamine Nation by Anna Lemke, which you can refer. It's a very interesting read. And we discussed this book in a blue book club also. And it talks about all about dopamine and addiction. So let's go further. And in the third part of the talk, where I will talk about the treatment strategies. So let me start with this that while ADHD is a serious health disorder, it is highly treatable. So, you must have heard or read somewhere that you don't grow out of ADHD. However, this statement is scientifically inappropriate because our brain has the power of neuroplasticity, meaning the brain has the capacity to develop new circuits even later on in life. So, a lot of people actually do grow out of the deficit. That's the first point because their brain develops. So, the treatment approach for ADHD is multimodal. What it means is that with the medication, with counseling, behavioral therapy, there are also parent training, educational support, and education regarding ADHD, like what we are doing right now. This is the first, we should be aware of the signs of ADHD and what it looks like in a holistic way. So let's talk about the medications. There are five different types of medicine licensed for the treatment. They come under two categories. One is CNS stimulants, which are stimulating the nervous system, and the other is the non-stimulant category. So the CNS stimulants, all the three which are mentioned here and their brand names are also given here, they are acting on the dopamine signaling pathway. They are either working on the dopamine receptor or they are either stopping the reuptake signal from the first neuron. So in this way, they can work. And the non-stimulants, which are the two which are mentioned here, the widely used, they are working on the non-adrenaline reuptake inhibitor. So non-adrenaline, I will talk in a little while. It is important to increase the energy to start focus mechanism. So it brings you into the focus zone, and dopamine is the one which takes you forward. Like you need uh, the focusing going on, and dopamine will help you there, but non adrenaline will help you to start the focus. So these drugs work on that pathway, but it should be important to understand that the drugs should not be taken in without the prescription. These drugs can be exploited by some people because they give you a kind of focus, and if you don't have the symptoms or the deficiency of dopamine, then if you are taking these, you can get addicted to it, and it can lead, it it comes with various side effects, and so you can develop depression, or some drugs can have more serious effects like including suicidal thoughts or liver damage. So it should be not misused. You should understand that if you are lacking in the dopamine deficiency, which ADHD people do, they need these drugs. Not these drugs should not be exploited for fun, for just getting the focus or just getting the task done. So it's important to clarify this point here. So let's just understand about this arrow model of focus. We talked about these neurotransmitters and their role in focus, attention, but how they work. I was talking about this a little bit earlier. Like you need adrenaline or epinephrine to increase the energy and alertness. And then the acetylcholine, which is another neurotransmitter, will help you to direct attention and focus to a specific spot. And then you need dopamine for your ongoing focus. So this is how the three neurotransmitters work together to help you to focus or concentrate in a task. So let me bring this topic again. Adderall is a good drug, no doubt about it. But what we have to be careful of is how do we use it? So it is interesting to understand that Adderall is actually consumption without prescription is higher than cannabis use. These are the statistics which are surprising and which are actually taken seriously. So upwards of 25% of people under 30 take Adderall without a clinical diagnostics to improve focus and keep up with the work. So we have to be careful about this. A single bout of focus with these drugs will give you a little bit of like confidence that you can do the work, but this can lead to you path of addiction, depression, and even more serious conditions in your body. So this should not be taken lightly. So then we have non-pharmaceutical and behavioral treatment for ADHD, which is behavioral therapy or cognitive behavioral therapy. What these therapies do is they develop a kind of like positive reinforcement. They do timeouts, token reward systems, and can be used to encourage desired behaviors. So therapists work to refine your prefrontal cortex. They help you to develop problem solving skills, and they help you to better manage the emotions. So then there is a lot of parent training. If you are interested to go into detail, I will not talk about this too much here because we are short of time. But if you want, you can read The Scattered Minds, where Gabor Mate has explained it in detail how parent training is important, because this is a developmental brain issue. And so, if we are giving a right environment to a child, especially for a very sensitive child, we have to be very careful. And even if your child is with ADHD, you have to be very understanding of the child's needs. And if you're giving time out, you have to be careful of how you are giving the time out. You should not undermine the parent child connection or make the child feel rejected or unloved. So, few tips and tricks that's given in the book very clearly. I will just go through the headlines of that and you can go into detail if you like. So, it's important to have a strong nurturing connection. It is important to have a compassionate and empathic approach to parenting. And it's important to have emotional intelligence. You have to develop emotional intelligence in your child. It is like how you provide them with tools to cope with their stress and frustration. So this is important. So in this, meditation and exercise helps. We will talk about this. And so the children with ADHD need to develop a strong sense of self-worth and confidence. So these children are lacking dopamine. Dopamine is the one which gives you this self-worth and confidence, right? So if they are lacking, they are lacking in the self-worth arena also. So it is the duty of the parents or caregivers to provide that positive reinforcement, celebrate their accomplishment, and encourage child's interest and passions. So I've told you this, that ADHD is not about intelligence. They are intelligent kids, and they are also hyper focused if they are interested in particular task. So it's important to understand which tasks interest them and allow them to do that, and also teach them all that strategies to deal with stress and frustration. So it's important. And then I cannot emphasize on this more. Sleep is so important. Sleep hygiene is very important for everyone. But if you are a person with ADHD symptoms, you need more sleep and a more good quality sleep. I have a whole presentation on this on the YouTube channel. You can go in detail on if you want to go further and learn how you can develop good sleep hygiene and what sleep do, the science of sleep and everything. It's given there, or you can go there. I will not go into detail here about this. Then we have exercise and meditation. So what exercise do? When we are exercising, we are actually increasing these neurotransmitters in our brain. It gives a sense of euphoria, it gives a sense of self control, and it also helps to motivate, because dopamine is getting increased when we do these kind of exercises. So, a very small, like swimming, running, or any kind of activity which increases your heart rate is good. So, no need to go to gym for doing exercise. You can just take a fast walk, or run, or do any kind of activity. Like if you're doing active gardening or actively cleaning the home, also is kind of an exercise where your heart rate is increased. So exercise is important, then mindfulness and meditation, and specifically um, focusing on location one inch inside the head, which is the prefrontal cortex. It helps for enhanced cognitive performance. It can reduce stress and improve mood. And this is interesting because when you are meditating, you are interocepting, you you are looking inside your emotions, and you are kind of dealing with that stress. um, it helps you to grew new neuronal connections. It's difficult for a ADHD person to sit quietly for long. So the idea is to start from 2 or 3 minutes and then build up. And 30 minutes per day is beneficial. Or is who Wendy Suzuki's research paper came out with this number of 13 minutes, and you can go read the paper further to understand what she talks about there, like how meditation helps. So, one more important thing which she has mentioned there is that um, don't do meditation before going to sleep, this kind of meditation specifically. So, there are meditations which can help you to sleep, but when you are focusing on your prefrontal cortex, this kind of meditation should not be done before sleep time. It will affect your sleep. So, diet and nutrition also play a very important role. We can talk about this in detail, but because of short of time, I will just stick to two things here, that reduce sugar intake, reduction, one thing, reduce sugar intake, preservative food, and processed foods, highly processed foods, avoid that, and increase omega 3 and tyrosine rich foods in the diet. Why omega 3 and tyrosine? Omega 3 is the building block for fatty acid, and our neurons are covered with myelin sheath, which are nothing but fatty acids. So that's important. And tyrosine is the building block of dopamine, and dopamine is important for motivation. We've talked about dopamine in detail before. So these two are important. And just a caution before including all this, talk with your health practitioner, or if you are on ADHD medications, talk to them about this, whether it will interfere with the medication or not. So don't just take it by yourself or while hearing here. Remember that to discuss this with a health practitioner. So at the end, I wanted to bring this thing into like a perspective. Importance of holistic approach is important. We should not ignore the complexity of human behavior and brain complexity of human brain. So we should be aware that child's temperament is important, how the child is dealing with the stressful situation, whether the child has developed like the activated stress response in the body and the freeze response is activated. And so, if a child has undergone like severe adverse childhood experiences, child has faced, so it must have affected its brain development. So, all these things should be considered when going, when a therapist is treating you. All these things should be taken into consideration. So, this is what the holistic approach, which for ADHD will look like. So, just I'm ending this presentation very soon, but before that, I just wanted to make sure that you are aware whether unknowingly your child is consuming caffeine. Caffeine, is a stimulant, right? So, 4 to 6 year old child is not recommended to have caffeine, but we have caffeine in sodas, colas, energy drinks, chocolates, cocoa, Red Bull, tea, iced tea. All these have caffeine in different concentrations. So you should be aware whether your child is drinking all this or eating chocolates a lot. So this should be also taken into consideration. And this can increase individual sensitivity. It can disrupt sleep. So it is also individual to individual effect. You should be aware of it, whether these things your child is eating, and these things contain caffeine. And just to be aware of this, that these food additives, preservatives, are actually not harmful in normal quantities. But recently we have increased the consumption of fast foods, and we have increased the consumption of preserved foods. And for the preservation, these companies use sodium benzoate. Though sodium benzoate is very safe, but if we are eating more, for some individuals, they can increase hyperactivity in children, both with or without ADHD. So this is important. More research is needed to understand the link between these and ADHD, but it's important to have an understanding of this. If your child is very sensitive to these artificial food colors and sodium benzoate, then you should reduce the amount of fast food in the child's diet and reduce the consumption of frozen foods or preserved foods. So this ends here the treatment strategies. Now I want to just highlight one more important aspect of, like, there is a debate where it is called that ADHD or ADD is overdiagnosed, and it's the marketing effort by big pharma. So if you want to go into detail about this topic, and if it interests you, you can and read Ellen Schwartz's book of ADHD Nation. And this is the interview which was given, like, two-part series where they have discussed in detail what is their viewpoint, why they are saying this. And so it's important to understand this. So at the end, I will quote from the ADHD Nation, where it is said that we have decided as a society that it's too expensive to modify the kid's environment, so we have to modify the kid. So it's very deep. Yeah, there is a lot of depth in this quote. So being a scientist, being a researcher, I have to put two sides of the story. So this is the other side, the the negative side, or the exploitation side of the big pharma, big money people. So you have to understand the ADHD as a whole. So this was important for me to put up here. If you are interested to read further, these are the resources, and I have also researched them, and I have taken the material from these sites. So I have this YouTube channel where I'm putting all these stuff which we are discussing here. So you are welcome to go and subscribe there, and please do subscribe because it helps others to find the educational material, and it helps to spread the word. So welcome to subscribe. And because in 1 hour we are covering so much, it's difficult to keep all that material. And you, if you want to refer back, or if you want to send it to your friend or a family member you find will be interested to learn about this, you can do that. And after that, will ask for this support for the community. If you love what I am doing, and if you are getting any benefit from my talks, I welcome you to become a Patreon of Curious Minds community. There are two different kind of membership level, and it comes with additional benefits. So please do consider that. And thank you. Thank you for listening and being here. And thanks for your interest in science. So now the meetup is open for questions and discussions. And please do check out the website, which is www.curiousandcreativelab.ca. Thank you.